when they see me and they say, hey, you're not talking about drugs, you're not talking about surgeries, you're telling me to eat right, and you're giving me some treatment options in which my body can heal itself, and I can get back to work, and I can stay active, and they're on board with that.
Hey, Smart Chiropractors, I'm Dr. Jeff Langmaid here with my co-host, Dr. Jason Deitch, and you're watching Clinical Conversations. Today, we have a guest that's coming on for the second time, Dr. John Pitts. He is a fantastic doc located out in Colorado, and he has interests that align so much with chiropractors. We're talking nutrition, natural health, fitness. This guy is a wealth of information, and we are fortunate, John, to have you on today's episode. We're going to talk a little bit about kids, dive deeper on some topics we touched on before. And I just want to say thanks for coming on today. How are you doing?
I'm doing well. Thanks for having me. I appreciate it. Yeah.
You got it. So I want to kick it off with a question just to kind of drive right to the heart of it. Our docs have been talking about kids, adolescents all month long with their content campaigns. When you see younger people in your practice, maybe we'll outline some of those most common injuries. Are people staying proactive? Are these ACL injuries? Are you seeing Tommy John type things going on? What are those common things you see in your practice relative to the younger population?
Yeah, absolutely. First, after I get over being jealous of how good a shape they are, I'm excited to see kids because they heal up so well. And so the most common things that we see would be like a UCL sprain in a picture that otherwise may be a candidate for Tommy John surgery. We see ACL tears pretty often, or sometimes if the ACL is too, like I have a patient today whose ACL was too far gone, had surgery, but he's got a patella tendon graft, he's got a meniscal tear, his MCL is loose, his IT band is injured, his hamstring is a little frayed. So we're going to address all those things to enhance his recovery from surgery and get him back to sports and athletics. I've actually taken care of some chiropractors in the area. They're younger kids. They just have some minor injuries like the shoulder sprain, a rotator cuff minor injury, knee sprains, patella tendinopathy. Things like this are the most common things we see in mostly adolescents, teenagers, or young adults.
For all of those of you watching, the reason we bring you these conversations is because, Dr. Pitts, a medical doctor who specializes in regenerative orthopedics, as Jeff said in the very beginning of this, we are completely aligned. And you really would never hear us say that about most medical doctors, which is why we're having this clinical conversation. If there's any group of people I know that are looking to, as Jeff said, be proactive with their health and or reduce their need for drugs and surgery, it's chiropractors and our families. So just to make sure those watching going, what's going on? What are you guys here for? We're here to help you, chiropractors, be smart chiropractors to make sure you're really doing everything you possibly can and you've got access to the resources that you need in the event that you, like everybody else, get hurt, get injured, or your kids get hurt and get injured. John, you've taken care of a lot of chiropractors, and I know they're kind of a healthy part of your practice. What have they found to be sort of their aha moments when they meet you and when they have the experience and when you've talked to them about, what their options are? What are some of the things you're kind of seeing consistently that they go, I didn't know that. Oh, wow, that's interesting. What are the things that most chiropractors don't know about what you do that they should know?
Right. Well, yeah, a lot of chiropractors are hesitant to go to the medical field just because of some past tensions, and they don't want to do surgery because they know if they see an orthopedic doctor, they're going to probably recommend surgery, and they're smart enough to know I'm not interested in getting my back fused. No, thank you. And so when they see me and they say, hey, you're not talking about drugs, you're not talking about surgeries, you're telling me to eat right, and you're giving me some treatment options in which my body can heal itself, and I can get back to work, and I can stay active, and you're not saying, hey, just quit your job and find another career. They're on board with that. And so I think of a good example. I have one chiropractor who's actually out of state, and he sends me a lot of patients, mostly chiropractors, because you guys are very abusive to your bodies just for your profession. And then you tend to be young and healthy and athletic and want to do sports outside of that. And that's just kind of like us medical doctors, too, that are at my practice. We like to have fun and do stuff. We're doing procedures all day. So we all have spine problems. So, I'll treat his back. He'll get a lot of improvement, then realize, oh, yeah, my neck's been bothering me, too. And then we treat that, we get that better, and then, just kind of work our way through the different problems that you've just been pushing through and dealing with. And then once they see how this works, recovery's pretty quick. They can get back to work fairly quick. They're pleased and they're happy and they're excited because they're like, hey, I'm going to a doctor that agrees with what I do and it doesn't want to do surgeries on me. So they're right on board.
John, what do you find to be some of the common injuries chiropractors are having, knowing they're in practice, they're bending over tables, they're on people all day long? What are some of the common injuries many chiropractors are finding? And is there some advice you have for them to help, be healthier in their approach and what they're doing?
Right. So most common things we see is spine problems. So degenerative disc disease is a big one, annular tears, discogenic type pain, radiculitis, radiculopathies, cervical pain, cervical instability, cervical degenerative disc disease. Those are the big ones that I see. And then also I'll see a lot of chiropractors with, once they get later in their career, develop CMC joint arthritis, or thumb pain from a lot of the adjustments. So actually, I just saw a chiropractor today who I'm going to treat their thumbs later on. We're going to evaluate that. So those are the biggest things. And then, obviously first we're talking about, hey, anything you can do at work to make it more ergonomic, to build your core, to work on your posture, your core muscle strengthening, things like that, where if you can avoid bending or at least bending properly, could that help out? So most of them have tried that or at least working on that best it can. But just the nature of the practice, you still put a lot of stress on your body with a lot of adjustment for sure.
You brought up something, John, that I think is really, really important, and that's degenerative disc disease. I think this has been probably since the first MRI or X-ray was taken a topic of hot conversation. Does it matter? Does it not matter? What's really the scoop? I would just love to have your insight in terms of when you guys take care of and treat an area that has significant degeneration, are you trying to pause it? Do you normally see improvement on film? How does that break down in your world? Because I know it's been a bone of contention kind of across the healthcare space for a while.
Oh, yeah. So, just the fact that you say degenerative disc disease can mean many different things. So we get into the little details. So degenerative disc disease as a topic is very broad in general. So we have to find specifically for that patient what are the specifics. So is it just some disc bulging causing radiculitis where you're getting more nerve irritation? Is there a tear in that disc that's causing pain or chemical radiculitis? Is it causing compression on the joint? So you're having some scoliosis or some spondylolisthesis. So we're going to look at all those things and address it. And so most commonly for things where it's just disc bulging, radiculitis, facetogenic pain, doing some specialized PRP procedures to the targeted areas around the nerves, the joints, the ligaments for support will help to stabilize the spine from a ligament standpoint, will help calm down the nerve irritation and actually get those nerves to heal and work better. And to some degree, partially help with the disc bulging because your body can, to some degree, help disc bulges depending on how big they are and where they are. And then after that, you should be able to do more core physical therapy work to build things up. Now, if we have a disc problem where there's a tear in the disc, then sometimes we have to go into the disc and treat inside that disc to heal that tear, which you will see MRI changes in most patients that are positive where those tears look small on MRI. Perhaps the bulging looks small on MRI. But we don't necessarily regrow your new disc or make it look like 20 when you're 50, okay? So there are some things we do that you see change on MRI, but mostly we're looking for functional and symptom improvements. But it's different than steroids in which, that's just taking out pain for a few weeks or a few months at most. It's not doing anything to help the healing. And in fact, doing the opposite was causing more harm. We're trying to get your body heal itself to some degree. It's not always a cure. But you can fix disc tears, which is a little bit of a cure. You can make the disc normal, and you can fix those ligaments for stability, which is partially a cure. You can help joint arthritis and slow that process down, but it's not 100% cure for life. But, all chiropractors know you see spines look bad all day. Some patients in severe pain, some people not too bad at all. The person itself varies quite a bit as far as the symptoms because they don't match the imaging in most cases.
Yeah.
John, what I want to make sure our chiropractors are all hearing is there's so many philosophical, concepts and ideas that we are completely aligned with. And I guess pun intended, because alignment is one of those major concepts. I know you focus on the SAMS principle of A being alignment. How help chiropractors understand, if we can dig a little bit deeper. Most chiropractors, if they've got some sort of injury or start early on, they start feeling something. Most are aware enough to know what likely is going on. They're hopefully probably getting adjusted themselves, trying even different chiropractic techniques and so on. So when people have exhausted those options and there's still issues, help people understand, philosophically, what are you thinking, and how do your treatments address those issues? I know from our standpoint, we're looking for sort of the stuck or subluxated areas that are hypomobile. And you look at things more from the standpoint of where they're hypermobile. How do you think about that? And then how do your treatments address those areas that our treatments really don't?
Absolutely. So, chiropractic is great for getting your posture in alignment and physical therapy, all those things. And so when you've exhausted all those resources, you basically have three broad treatment options. Or four. One is just deal with it, not usually a good idea. Two is like, I can just do some things to manage the pain. So these are things like medicines, steroid injections, radio frequency ablations, which have pluses and minuses, don't heal anything. Three, you can try to get that area to heal up to some degree so that you can improve your health yourself. And then four is doing some kind of surgery where you're going to alter your biomechanics forever and hoping that the injury from the surgery is less severe than whatever it is they try to attempt to fix, which is, 50-50. And so we fit in that third category where we're trying to get your body to heal itself to some degree. And so for us, we might see a little asthesis or some changes on flexion extension x-rays that let us know, hey, that L4-5 segment is unstable. We need to treat those supraspinous, interspinous ligaments, those intertransverse ligaments. Hey, you got degenerative disc disease that's putting stress on the facet joints that's causing facet pain. We need to treat those joints. Hey, the disc has a tear. We need to treat that disc. So we're looking for these specific things that we can treat to make stronger. And oftentimes I'll tell folks, hey, if you're working with a chiropractor and your alignment's off, something's hypermobile, get that adjusted before you come. We'll treat you. And then as you're healing up, continue those adjustments to make sure you're healing in good alignment. So as your ligaments and tissues heal, they'll be in a better aligned spot. And so maybe moving forward, you may need less frequent adjustments to maintain that. So we really complement, a lot of what physical therapy, chiropractic, other modalities that aren't as invasive as injections do, really just help make your job easier and help you get the patient better, including yourself.
I like it. There was something you brought up on the answer to the last question. You mentioned in passing, but I'd love to dig a little bit deeper, especially as our docs have been talking about kids, and many of them have kids themselves, and it ties to lateral curves and scoliosis. When you see that, and I'm not talking about 60 degree, 70 degree that are these really outlandish cases, but when you see a case that has a minor, a mild to moderate curve, how do you think about that? Is that pain driven? Is it imaging driven? How do you configure your treatment options? Because I know so many docs out there, chiropractors, we see a lot of kids with scoliosis, and the last thing that anybody wants to see somebody go through is Harrington rods, unless it's a life-saving measure. So how do you approach scoliosis in your practice?
Absolutely. So most of the time, we're going to see patients that are not in a surgical candidacy, which is great. So usually only ones that need surgery or they're having some breathing difficulties or those very extreme curves. Mm-hmm. So most of the time, we're seeing folks that have typically been working with some chiropractors to help them with their curve. And then we want to try to help the chiropractor get some more range of motion and more straightening of that curve, as well as strengthening the ligaments that are going to get extra pull and extra stress. So most of the time, when you have a scoliosis, you're going to curve one way, and so whichever side, the convex side of the curve where you're curving away, is going to pull on those intertransverse ligaments. So we can target those specific ligaments based on the imaging to try to strengthen those up, and so that'll help any type of chiropractic care to try to help the curve. And I just talked with a chiropractor today. She says typically after I treat her patients, they get an additional 5 degrees of mobility just from that, okay? And then another part of that is you get rotation, all right? So when you get some rotation, that's going to pull on the thoracodorsal fascia. So whatever side is getting that pull of thoracodorsal fascia, we can tighten that up to help with that part. And then wherever you're getting kyphosis, that's the supraspinous, interspinous ligaments, we can treat those to help with that. And then we're going to evaluate the patient for pain, if they have facetogenic pain, discogenic pain. So if they're having some facets that are getting overloaded from the curve or from the rotation, we'll treat those joints. We'll have a lot of patients with scoliosis that rib facets are hypermobile or out of place. And so we'll treat those ligaments around the rib facet capsules. And then we're always got to think about, do you have any underlying problems that predispose you, like Ehlers-Danlos or some hypermobility? So the patient I saw today with scoliosis had hypermobility. So we know that predisposes you to have weaker ligaments. And we also know the treatment's going to be a little bit different. So if you didn't have hypermobility, I might be doing more PRP. If you do, I'm going to do more Prolo because that tends to work better in that group. And we can enhance the Prolo with some special growth factors because we have a lab to change up our PRP formulations to target specifically what we want. So we can make little adjustments like that. So we're really looking very comprehensively at the little details of the patient's history, their symptoms, their goals, and their imaging to make a specialized plan for that person.
John, I know we don't have a lot of time left, so what I'd like for people to be able to learn is, how does it work? So whether it's a chiropractor who's in our group who's going, I've had a pain in the ass for a while, it's still a pain in the ass, and I need to do something about it before it gets worse, or a family member, if it's their, children playing sports, or even, whether it's people on their staff, maybe even patients as well. How does it work to learn more about if you can help them? I know you do teleconsults. I know when it comes professional to professional, you're extremely accessible. Lay out, if chiropractor's got questions, what's the process? We'll put all the details about how to reach you, but just generally, what's the process? They can text you, they can get on a virtual call like this. Explain to people, what can they expect if they reach out to you?
Yeah, absolutely. So as long as the pain in the butt is actually a pain in the butt and not somebody else is getting on your nerves. So you can, if you have my email or phone numbers on our cards, you can just email me directly. I'll hook you up with our staff, who our schedulers will help to set up, if you're out of town, a telehealth visit. So you can send in your imaging. We'll spend 40 minutes on the televisit, discussing your history, going over your imaging, seeing if it seems like you're a fit for this type of treatment. And if so, we can set that up. If you live locally, then it's great to come on into the office. We can do all those same things in person, as well as evaluate you hands-on, which gives us all the information we need, and then we can come up with a specialized plan. If there's some imaging that's missing, don't worry about that. We can always get that either before the visit or after the visit, depending on goals, insurance, and things like that.
That sounds absolutely fantastic. I know, Dr. Pitts, you are loaded with patients. We are lucky to have you for the time that we have. We're going to drop also all of that information, your information, down below, so docs that have additional questions can reach out. We'll make sure that they get to the appropriate channel. We want to thank you so much for coming on, talking it down. It's always great to understand from a different perspective how you think about care. There's so many synergies. The most important thing is that we learn together. So all those docs watching, if you have questions, drop them down below. Jason and I will stay active in the group and keep a look. Dr. Pitts, thank you so much for being on. And docs, we'll see you in another couple weeks for another episode of Clinical Conversations. See you guys. Hey, if you like that video, be sure to subscribe to the Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.